In our workshop in ICS 2026, Making Sense of Interstitial Cystitis and Bladder Pain Syndromes, we bring together the international experts, Professor Guo from Taiwan, Professor Burders from the United States, and Professor Akiyama from Japan, and me. We will discuss about how to diagnose the IC-BPS much more precisely and how to give the optimal treatment strategy to this kind of patients. What made this workshop much more exciting is that we bring together the experts from different disciplines and different countries to try to present an updated framework to the clinicians which can apply it in daily practice. Honestly, IC-BPS is a complex condition which involves multiple systems. For example, like the urothelium, nervous systems, and the immune response, and the pelvic floor functions. Because of this complexity, IC-BPS treatment requires collaboration from all disciplines. Our workshop provides a framework that includes the clinical evaluation, cystoscopic finding, urinary biomarker, and emerging technologies such as AI. This multidisciplinary perspective helps clinicians, researchers, and health professionals to better understand this complex disease and how to select the optimal treatment strategy to your patient. ICS meetings are very special because they bring together the experts from all around the world who share a common interest in improving the understanding and treatment of lower urinary tract disorders. What I particularly appreciate about ICS is the strong integration of basic science, clinical research, and multidisciplinary collaboration. ICS 2026 will provide an excellent opportunity to exchange ideas, learn from international experts, and discuss the latest advances in neurourology and functional urology. I strongly recommend colleagues from different disciplines to attend and participate in this big scientific annual meeting. Thank you.